Well, I'm pleased to announce that early this morning another flight of evacuees arrived here at Travis Air Force Base. 201 passengers were screened, and among those passengers that were screened, 53 of those actually will stay here locally. Among the 53 that were staying here at Travis Air Force Base, there were 4 individuals that were found that were needed to have additional medical workup in local healthcare facilities.
I think the wording, actually I'm going to move this up a little bit. I think the wording was that they started to develop symptoms. Can you clarify what that means exactly?
Yes, what that means is that fever, for example, or shortness of breath, or cough, or symptoms that we're screening for, those symptoms combined with the exposure to Hubei province, where there's a widespread community transmission of this novel coronavirus, those symptoms and exposure together makes them more at higher risk.
So they were taken to area hospitals?
They were taken to area hospitals for additional workup and laboratory testing, both for novel coronaviruses, but also for other diseases as well, for example, influenza.
Now, area hospitals, should the public be concerned?
No, the public should not be concerned at this point. Again, as I said, there's a number of things that would cause a fever or cough or shortness of breath, and these people actually are under isolation with standard precautionary measures that are known to prevent transmission of these types of respiratory viruses.
You know, with reporting the story, there is a lot of disinformation and fear out there. What would your advice to people be? Like, you know, say they are getting treated at an area hospital here, since we're not releasing it, and they're worried. What should they do?
Well, one of the things they could do is to get their flu vaccine, because that would be much more likely to be infected by flu than the novel coronavirus. One of the things we're emphasizing is the public shouldn't go out and buy a mask and wear a mask around in public. We think that that is not very useful in this particular instance. The transmission of novel coronavirus is through droplets, and you really only will be able to acquire the infection through close contact within 6 feet. So the community around these healthcare facilities where these patients are being held in isolation are at no risk.
But I guess at the end of the day, it's also practice good hygiene.
That's correct, and we always want the public to wash their hands and especially not touch their mouth and nose during this season where there's a lot of respiratory viruses being transmitted.
And it seems to me that this was, you know, part of the plan, because the evacuees were getting screened at every step of the way, and this is how.
That's right, and so we're screening them first and then trying to identify those at higher risk and pulling them out. And the other evacuees are being put in a 14-day quarantine. We don't want to mix in symptomatic people actually with the well people, so that's why we're screening them first.
Excellent. And then let's see, I know I have one more question. Is there anything else you would like to add?
I think that's pretty much covered it.
Okay, yeah, I think, here it was. Because you said 4 this morning, but I believe the total is 5, correct?
The total is 5. From the plane that arrived approximately 36 hours ago, there was one individual as well that was evaluated, or has been evaluated in a local hospital.
Was that the baby?
That child is doing quite well.
Okay. And then finally, are there any more planes, evacuees expected?
Not to my knowledge.